Hello, my name is Paul Rosenberg. I am a professor in the Department of Endodontics at New York University College of Dentistry. I'm also an author and a practicing endodontist. Recently, I wrote a book titled Endodontic Pain. It reviews the causes, diagnosis, prevention, and management of endodontic pain. I want to briefly review the importance of anxiety to endodontic treatment. What is the importance of prior painful dental visits? What is memory is a related question. Memory is the ability to recreate an act separated by some time from the original signal set. So when a patient says to you, "I have had root canal therapy done before and it was the worst day of my life," that needs to be considered as more than a throwaway line. It's an indication of your patient's state of mind. There is an inverse relationship between anxiety and pain threshold. As a patient's level of anxiety increases, their pain threshold is diminished. High levels of stress, anxiety, or pessimism in preoperative patients predict poor outcomes, including speed of wound healing and duration of hospital stay. It's also been shown that psychological stress can negatively affect healing. Findings suggest that chronic stress impairs the early inflammatory response. Furthermore, increased levels of the anti-inflammatory action of cortisol is associated with delayed healing. Pain and stress are synergistic. Pain has both physical and psychological components. Release of cortisol and norepinephrine dysregulates immune function and alters early wound repair and increases the risk of infection. There is clinical relevancy to this biology. A study was done some years ago on dental students that related the presence of stress and healing. Dental students received a 3.5 millimeter palatal punch biopsy at two different time points, just before their examinations and during summer holidays. Students took 40% longer to heal during the examination period. No student in the examination group healed as rapidly as those in the holiday group. Stress apparently alters neutrophil function. In a landmark study on anxiety, it was shown that preoperative discussion of the surgical treatments and associated discomfort reduced by 50% the need for postoperative morphine and reduced the time to discharge. There are specific therapeutic approaches to the anxious patient. The dialogue is extremely important. The few minutes spent speaking to the patient about what to expect and your pain preventive strategies may have significant outcomes postoperatively. Some patients come to you having had nitrous oxide. Others you may want to suggest it to. There are some concerns that organizing a rubber dam and nose piece may be too much for the patient to tolerate. But in the image that you see, you can see how every piece of equipment seems to be well organized and in place. The eyes are protected, the nose piece is in place, and the rubber dam is also in place. When it comes time for a radiograph, the rubber dam remains in place, but not on the frame, and the nose piece is removed for a short period of time. Oral medication is yet another option, and the ultimate option in those who are severely anxious is IV sedation. I want to emphasize that most anxious patients can be managed by a thoughtful dialogue with the dentist. The anxious patient presents significant challenges to the clinician. Most patients list root canal therapy at the top of their list in terms of fear and anxiety. The importance of managing the patient's anxiety cannot be overstated. Most patients can be helped significantly by discussing the procedure and your approach to pain prevention. Also important is emphasizing your availability should an emergency occur after hours. Patients' questions should be welcomed as a means of reducing their anxiety. I hope you find this material interesting and useful in your practices. Good luck and thank you.